Well, good afternoon, everyone. This is our regular meeting of the Fargo Cass Public Board of Health. We are meeting live, obviously. We do have an agenda in front of us, and so we will start with number one, announcements.
And I don't know that we have really any announcements. We were going to do we'll do a COVID update, I think, at the end, just to give updates on what's all been going on with that. But yeah, other than shifting all of our meetings around and doing all of this virtual meeting format, I don't have any further announcements.
Okay. We appreciate how busy you've been, certainly. On the next item, agenda item 2, for budget, we'll turn that over to Melissa.
Okay, I'm not sure what format we've used last year. We sent out the revenue numbers and the expense numbers, and I just had Lori send out the Cass County services budget and the jail budget. Those numbers might not be finalized yet because we're still looking at that. We don't have to have that to Cass County till the end of July. And so depending if there's any discussion today on those numbers or any thoughts after the fact, we can still change that budget. So if anything comes up, we'll deal with that down the road. Our budgets, we tried to, I don't know if hold even is the exact wording, but we tried very carefully to stay as close as we could. So I'll go through some of the numbers. I'll go through the revenue lines first. The grants, that first category is the federal grants we get. And each line item represents basically what we think the funding will be for next year. Some of them we won't know until next July, whether we're close to next July for funding that starts July 1. With everything that's going on, it's really hard to say what's going to happen. And of course, when we've reached out to the state, they don't know what's going to happen either. So we think things will continue where we're at. I can tell you, family planning, we did get an increase in that grant. Pretty good increase because of the Planned Parenting stepping out of some of that activity. And so that came to North Dakota and we got an increase in that budget. We're decreasing the HIV revenue just a little bit based on what we're actually providing for service. Immunizations, that's just a kind of historical increase. Ryan White, that's an increase in the grant funding. Let's see, the next one down is WIC, and that's also an increase. The last few years we've been getting increase mid-year, and we don't see that changing, so it's increased slightly. Emergency preparedness, that's our FEP grants, and we still do not know if we're going to get CRI funding, fully funding, so that one we did leave off. We only put in for January through June. If we get funding starting July again, we'll increase the budget mid-year. So that could change. That would change. If that happens, that would be an $80,000 increase to that line item. So let's see, where am I? We'll go down to North Dakota chronic disease. We've been getting closer to that mark, 25,000, so we just increased that one. The MCH grant, I think this was the plan all along, was to drop down to the 120,000 from the first year that we received the money of 160. So that was expected. Doesn't really change our services a whole lot. We got rid of some contracts that we were doing. The rest of the line items in the federal grants have to do with opioid, and a lot of that funding was one-time funding, so we won't get that as far as I know. Continue on down the line. The state grants that we get, active TB is the next line item, and that is based on what's happening at the time. So there is no actual contract. The state will just pay us based on the activity we're doing. So This is kind of the current activity level, so we changed the numbers, but we could get more funding if the TB numbers go up. Let's see what's next here. Substance abuse prevention. That grant is actually $37,000, but there are activities that we cannot do currently, and so we only get reimbursed on the activities that are allowed, and that's where we're at with that. So we had to change that number. If something changes, we could get more money, but at this current time, we don't expect that we'll be able to accomplish some of those activities in that grant. The tobacco settlement grant, we will get more funding in that line item, and that also will show up in a few other places in the contracts and the expense side. We do not know what our state aid funding will do next year, so we left that alone. I don't think it'll decrease. Local money that we get some funding from United Way for our nurse family partnership program, and that was a planned decrease. They're decreasing for next year, and they're decreasing for one year. So we know those numbers are going to change. Let's see, this county schools are contracts with our schools to provide nurses, and those have already been approved by the schools, so those numbers are going to sit where they are. Same with Fargo Public Schools. Down to the Gladys Ray Shelter VA contract. We are no longer providing that service. They took that over, providing it locally, and so that has come out of our budget. The MOP local money, that was, we were hoping to get money from Sanford and Essentia, and that has never happened because DHS has been funding us. So we're not getting the money locally from that. I don't know if that could change in the future. Depends on DHS, I suppose. Down to our self-pay line items. Family planning, we expect an increase. Hopefully, we're going to increase our client load based with the funding that we received and a marketing push. That should be happening soon. And so we're hoping our numbers will increase slightly. COPL, that is a service that's provided by one of our nurse practitioners, and that usage has been down. Down to server training, we increased that based on our history and the numbers we're seeing. Down to insurance and Medicaid line items, our third-party insurance, that's all the insurance carriers we bill to. Last year, the budget team increased our number by $120,000. That was not our expectation. So we're hoping that this number is a little more in line to what we think it will be. Nursing MA, again, we decreased based on what we think will be happening. And then down to Cass County, those are the numbers I just sent you guys, or Lori submitted just before the meeting started. We're not increasing, we can get to them, but we're really not increasing much other than salary in both the Cass County and the correctional health. Title 20 is a funding program through Cass County, and we expect that to be slightly lower as our clients are getting moved over to a different program provided by the state. And down to environmental, those numbers were all increased based on our history. So our revenue is slightly down, but again, if we get the CRI contract that we think, then our revenue would be still be short by about 10 grand, but we usually make that up. So I'm not too worried about those numbers, and hopefully this all comes through as we expect, because we'll be doing the job regardless.
Yes, you have been doing more than your job. Melissa, before I turn the gavel over to Chelsea, will you tell me what MOP stands for? MOP local?
Yeah, that's our mobile outreach program. So do you know what that is? That's with the Gladys Ray Shelter staff who
harm reduction. So it's really a lower level of response to work with those individuals with chronic substance use. And so if they are out in public and struggling, then, you know, rather than calling PD or calling first responder type people, they call mobile outreach. Typically mobile outreach has an established relationship with them, and it just seems to go a whole lot better when they respond. It's less expensive, lower level of response, and they're able to transport and get them where they need to be.
Thank you. I will turn the floor over to Chelsea, Chair Chelsea.
Sorry about that. I, of course, had some technical difficulties. I've never used this particular app before, so yeah, sorry about that.
It's all new.
So I assume that yeah, and of course, I'm trying to pull up the agenda too, and it's not cooperating with me.
We're still in the middle of the budget, Chelsea, so we just went through the revenue section. Okay. So if no one has questions on that, then
I just had a couple questions. You mentioned the loss of the opioid funding at the top. Is that something that we'll be able to still maintain, like the syringe exchange program, et cetera, without that funding?
Well, those were just specific grant program, like one-time grant things that came in. So it really doesn't, we still have the state grants and some other funding streams. Those were just kind of one-time sources that we had applied for. Okay.
And then for the MOP program, I know you mentioned you were hoping to get funds from Sanford and Essentia, and that didn't happen. Is that because Department of Health is still funding it?
Yeah, so it's Department of Human Services is funding it. So yeah, early on there was commitment from local partners to help with that because it was saving so much money locally. But I think because DHS saw the value in the program and the cost savings as well, that they kind of wanted to support that and kind of make that more into a model type program that others may use, statewide. And so they have been supporting it. I think they are having talks about, sustainability and going forward. So that conversation may come back on the table again, but just for right now, it was put in the budget a year or two back thinking that was the way it was going to go, and it hasn't gone there yet. So we've just kind of left that as an item just so it's there for a tagline for us to remember.
Okay, sounds good. And then with the colpos, you mentioned numbers are down. I'm assuming that those are for cervical cancer screenings.
Mm-hmm.
Yes.
Yep.
And is it just like lower flow through for that service?
I don't know if it's just been decreased numbers or usage or
I just want to make sure people are still getting those screenings somehow. If your numbers are down, are they still getting that screening somewhere?
Yeah, the colpal numbers would be if they actually had a procedure done. So the screening is still happening, but whether they choose to have it done here or their insurance will maybe cover it regardless. So yeah, the screening.
Okay. Perfect. Thanks, guys.
Yep. Okay. We'll move on to the expenses.
Madam Chair.
Yes.
Madam Chair, good. My sound does work. A question about the opioid funding, and I might have missed this in the conversation. I got distracted for a minute, but we had earmarked $50,000 from the city a couple years ago. Did you just discuss that?
No.
Okay. What's the status? What's the status of that?
Thanks, Commissioner Strand. So it's our intent to. Last year we brought it up, and it was known that it kind of got misplaced in our budget or removed. Initially, a couple years back, we had this funding earmarked for opioid syringe services. The following year, we had asked for it to be specifically put in a different category. And when they went to do that, it disappeared from our budget entirely. And so the city is well aware that money was earmarked and was in our budget. And so it's out there somewhere, but this year we will request that be formally put back in our budget so that we see it.
Yes, we're going to request it in our line item medical supplies because that is where we are in need of it the most. So because we have funding, we have state funding for the program itself, but they don't buy, it won't
doesn't buy supplies.
And so that's where we need the money, and 50,000 is the number we need. So we are going to request that in our budget. You'll only see an increase of 48,000, but that's because we decreased it in other divisions of our budget. So the increase in here is 48,000, but that's 50 That's the 50,000.
And my apologies, I lost you all for a minute there, and I hope you didn't hear me swear. That's good. If I can help in any way, clear the path for that, let me know.
Very good. Thank you.
Any other questions? Okay, then we'll go on to the expense, and again, this is it is our whole budget combined, as is the revenues, but we have 8 or 9 divisions. I don't know what the total is without counting them. And so this is the conglomeration of all of those individual divisions brought together, and this is the end result. So I'll go through them. I can kind of tell you where things are, why they're going up or down. And we don't have any numbers put in our budget yet for 2021 for salary and benefits. The city will do that as part of the process. So I don't know what those changes will be. So we'll just head on down. Our interpreters, we are using some different routes, and so we're saving a little bit of money there. That's going to decrease slightly. Our reference lab, that is increased in, some of it is just cost, and some of it is we're hoping with the increase of influx to family planning and also in our employee health staffing, that we're seeing the load is getting a little bit larger there, so we're increasing the cost for reference lab. The next line is our health officer, and that is a contractual increase, so we put those numbers in the budget. The next number, small one, decrease in computer services, that's a change in the employee health software, and we're saving slightly there. Marketing is an increase. Marketing in the next line, contractual, those are both due to the tobacco grant and the increase in the tobacco grant. Mowing services, that's an increase of $7,000. That's based on what last year's numbers were, but that $25,000 total projected for next year is also in the expenses, so those offset each other. We mow when there's complaints, and that gets billed to the landowner, and then they have to pay that plus a fine. I think there's $25 admin fee, and then that comes back to our budget. Our increase in other services, that is for an increase in taxi rides for the homeless shelters, getting the homeless back and forth between shelters in the wintertime. Those numbers go up quite a bit. Last year was pretty brutal. Building repairs, that increase is due to the Gladys Ray building. We are getting some work done, but still, there's still issues. It's an old building, and there will still be issues, I'm sure. Building rent, that's actually, it's just rental for some space we'll be using in the tobacco grant for some of the seminars they're going to be putting on. Decreases in some of our printing costs and our mileage. We are moving around vehicles. We have city cars, and we're moving them around to the highest users. And so we're keeping an eye on that, which decreases our mileage paid out to staff. We decreased some in-state and out-state travel. That's for required travel to Bismarck or to conferences. Dues and memberships in-state, that increase is due to required software for the Gladys Ray shelter that we have to use. Let's see. Reference material, that's just a decrease based on our history. Medical supplies, that's where we were talking. Again, it's 48,000, but it's a combination of an increase of 50,000 to the Gladys Ray, but a decrease in another program area. So an increase of 48,000. Pharmacy, we're increasing slightly. Again, it's down in some areas, up in others, and it's only a $3,000 increase. But we expect to spend that. And if we continue into the fall and there is a vaccine for COVID, then we're hoping to have maybe a different grant for that would cover that. But we also have, we just think we're going to increase maybe even flu shots due to the whole COVID experience. So lab supplies, that's a general direct reflection with increased client load. General supplies, that increase is due to its tobacco grant. Postage is just history, and then food is for the Gladys Ray Shelter, increase in based on what we've been seeing there also. So $93,000 increase in expenses. Again, that's pretty darn tight. So other than the $50,000 increase in medical supplies, the rest of it is really mostly grant funded. So that's where we're at with those numbers. Do you have any questions on that?
This is Rick.
I have a few questions. Oh, Rick or Robin, want to go?
Go ahead, Rick.
Okay, just a quick question. I know you haven't put in the 2020 or 2021 projected costs for compensation areas. Do you have any idea what you're looking at there?
We haven't heard from the city what their plan is at all. We have to have the payroll report back to them Friday, tomorrow, which I've already sent back to them. We're not requesting any staff, and I haven't heard a word. I don't know if Desi's heard anything.
They've pretty much, you know, they right now have a hiring freeze on for any extra staff, and I think we all recognize that this is not a good year to probably ask for things that you don't absolutely necessarily need. So I have no idea if there would be, you know, competitive wage and all of those things going forward. I think it's really going to depend on how we get through the COVID stuff, if there's reimbursement that comes federally or through other CDC grants, all of that, and how that kind of makes up some of our costs that we have incurred during this event.
All right, thank you.
I have a general question.
Robin?
Sure. On the revenue versus the expenses, I know there is a difference on the revenue of -94. So is that difference, is the difference in the budget? Are we $94,000 under budgeted revenue?
The difference is between the 2020 budget and the 2021 budget. That's the difference.
Okay. So conceptually, if there is a large deficit at the end of the year in spending, how does that work with funding, and how does that flow through the city and the county? Is there
the general fund? So one of the worksheets that we do for the city shows the general fund, and so the difference between the 6.5 million in the revenue and the 11 million in the expenses is all general fund. And you know, usually we meet both of these numbers at 100%, and so the general fund is usually less than we projected, and so we haven't had issues with that in the past with the city. So
that helps. Thank you.
Yeah, and like we had said, that CRI funding, you know, technically we've been funded for it. We're just leery about saying that we've been funded for it because sometimes they take it away once they give it to us. So if that is fully funded, then we would have another 80,000 to add into the revenue side, but we just don't want to say it's there because in case it goes away.
Mm-hmm. And in every year, it seems like we get random grants and we do a budget adjustment to reflect that as the year goes on. So the numbers change almost monthly. So.
Yeah, I have a few questions on this one. So you're not requesting any new staff. Is there a need given everything that's going on, or is that a separate budget item that's going to be funded some way else, some other way?
Yeah, so
we're just not requesting.
It's kind of a separate mission. We did get some funding through the state that we are going to be adding some contact tracing staff for COVID. Those would be kind of contract or temporary type positions, so they wouldn't file into our normal budget with the city. and those are projected to go through the end of the year. So that money kind of came through that Red River Valley Task Force. So we got some contact tracing support. There's some wraparound support, you know, different things that came through that funding, but that's a separate funding. We're also potentially getting some local public health support for our costs just in staff time that we have incurred since March. But those would all be outside of our budgeting process for coming up.
Yeah, none of that money, none of the money we're getting for local public health or for the task force will show up in our budget. It's all a separate fund and it stays outside of our budget. We do have our cost, you know, the hours that we are working that's less than overtime, they will show up in our budget as a cost, but we will get funded for that. That will get reimbursed for most of that.
Okay. And maybe we'll get to this. I'm just trying to think through with all of what we're experiencing. I would imagine there's some programs that aren't really being worked on, or, you know, so we might not use some of those grant funds. I'm not sure what the impact has been there and how that changes this picture.
So some of our funding, depending on what kind of grant it was, a notice of grant award or a purchase of service agreement. So if it was a notice of grant award, such as tobacco or FEP funding, so Doug Murphy's position, and a couple others, that funding had to be used first. So when they're doing time in COVID, it's billed to COVID, but then on the backside, I manually charge the grants and we'll draw down those grants first. Then the difference will go to the COVID funding we're getting. So it depends on the funding source. We are still doing, you know, nursing services, and we are seeing some family planning clients. WIC is not allowed to, we're not allowed to use that funding for COVID. They are seeing their clients, they are working. So it just depends on the funding source.
Okay. I just wanted to make sure we're not jeopardizing any future funds, knowing that focus has shifted elsewhere, at least for some of the things that you all do. So, okay. That's helpful. Okay. Do you have additional items, Melissa?
The only other thing is, like I said, we sent out the Cass County and the jail budget, and again, we didn't change anything in the operating. The only thing is, I figured out the salary and benefits, and we put in increases based on what steps people would have, and you know, we haven't been told that that's not happening. So, but for Cass County and the jail, those are direct costs. So we would request, you know, the money in these budgets, but if none of that happens, it won't get billed to them anyway. So if that makes sense. Okay. So.
And they may want some increase in staff time at the jail as well, but we haven't really had those conversations. That's just been thrown out that they may be looking for a little extra nursing support, although there is a space issue there as well. So we would have to be able to figure that out to support that.
Okay.
So I don't know if there's any other questions on the budget. We meet with the team on next Wednesday, the budget team, to go over all of this. I don't know that we'll know anything more from them, but
yeah, it's been a really different process this year, just because you know, no one's really had time to look at numbers. No one really knows what part of COVID stuff is going to be reimbursed, what's not, and so it's really hard to figure out how it's going to impact the budget. So it's kind of a lot of scenarios going forward, and we're just kind of, you know, we based a lot on last year, and just adjusting for that typical increase that we would normally do, you know, for the salaries and bumps and things like that. So,
Madam Chair, if I might chime in, and maybe this is a question for the team there or for Desi, but I want to be assured that we're not backing off on stepping up services for people battling addiction such as crystal meth. We've done a remarkable job on opioids, but we have this behemoth problem in our community. And I know with our harm reduction center and our needle exchange program that we're providing and through counseling and others, but are we for sure not backing off on providing those services and if possible, when we need to stepping them up?
Well, I mean, I think realistically, I think overall we have had to step away from some of things just because of our mission of, you know, when we're the lead locally for the pandemic, we've had to shift staff and do some creative things. Although I will say that the syringe services program has remained open through the entire time and has served clients. And so from that standpoint, they are reaching people that way and providing education. We haven't probably done, you know, we talked about doing some of the different marketing things and campaigns like that type of thing we have not done. We have not, it hasn't impacted our individual client interaction.
Good, thank you.
Mm-hmm. Any other questions for Melissa on the budget? Okay. Move on to the next item, which is COVID-19 activities and questions. Desi, were you gonna an overview on this one, or were you?
I just thought I'd give you a snapshot of the life and times of public health lately. So we opened our Department Operations Center on March 17th, and it has consumed much of our life and roles since that time. You know, we did, we still have people that have provided those essential services along the way. Like with our home clients, we had to look at who had other avenues for service. Did people have family that could take over, you know, med setups, different things like that. We kind of prioritize clients and put those on hold that we could put on hold or, you know, get them lined up with other family services. But then we continued to see those that had no other options for service while making sure that our staff were safe, being out visiting. We pretty much in the clinic kept going with our essential services of, you know, we wanted to make sure that, you know, STIs and all those things were still able to be checked so that we didn't, you know, put one problem aside for another and then end up with a bigger problem when we came back. Wanted to continue with birth control, different things like that that were more emergent need services. We did, as of a couple weeks ago when the city kind of opened back up, kind of, you know, brought in a few more services that we started to open up a little bit more. We've been cautious. We've screened clients prior to coming. We have masks available if visitors would need them, that type of thing. We've tried to be really aware of people that come in and staff so that we can have them be safe. Just some of the main roles that we have been supporting through this mission. We've been doing a lot of the fit testing, which is for, you know, the N95 masks that have to be properly fitted and sealed and sized for people. So they have to actually see one of our staff that do that so that they can, we do a lot of train the trainer approaches, but we also do groups. We've done, you know, thousands of people for fit testing throughout this process. We have done a lot with the Everbridge, which is our mass notification system. So that's, you know, any of the nursing homes or group homes or public health even, that have staff groups that they might want to communicate messages to. So especially like when the nursing homes went through the visitor restrictions, things like that, they would want us to send out messaging to everybody so that they could get those messages out to family, to staff. We've used it for testing events to let them know times and dates and where to come, that type of thing. So that has taken a lot. We do have some interns that have been wonderful for us as well, that have really supported Doug in his position, as he does a lot with the logistics piece of it. So the interns can help with those Everbridge notifications. They can help with just monitoring data for us. They help with logistics and setting up some testing events, all those things. So it's been a really, really good partnership with NDSU that we have had for that. For the facilities that don't have a medical director, when we've done the testing, Dr. Lako has served as that representative, so that she provides a standing order so that people can be tested. So all of those results then come back to our facility, and we have to then manage the results. So the positive results go to the contact tracing team, the negative results go to our nursing team, and they are notifying those people of their results. So those are huge numbers every day that we deal with. So that has been a big thing. Also, our contact tracing, we currently have 34 staff that are doing contact tracing 7 days a week, 12 hours a day. So that is a huge amount of our role. We currently are following 600 positive cases, 1,200 close contacts that are daily calls. Our environmental staff are working with businesses, providing education and help them mitigate if they have a positive individual in their facility, help them, get resource for testing if they need that. And then just help as the guidelines have changed from the state as far as, restrictions, and then now no restrictions, and kind of just advising on how to best practice and going forward. So they spend a lot of time doing that. Obviously, Melissa has worked numerous hours on trying to figure out the various, funding sources and what can be approved for those funding sources. And it's very, very complex. She's spent a bajillion hours on that, and that still changes every day as well. Messaging has been huge for us as far as just social media. We've done the weekly press conferences just for the local press briefings, for the health briefings. This past week, we did a task force. That was another thing, the Red River Valley Task Force. We started that May 7th at the request of the governor. So we have 13 partnering agencies with that. The mayor and I co-chair that task force. It's really meant to be a metro approach. Our kind of the activities or strategies around that task force have to do with the testing matrix. We weren't, that mass testing that they were doing across the state just wasn't working for us. We just didn't feel like that was the best use of resources. So we went to a solely targeted testing approach and started that. That was one of our first goals, was to identify some higher exposure areas and individuals, and then make a testing matrix around those individuals. So we have seen our numbers go up, which that's what we wanted to do. We wanted to find those positive cases, because I've always said, you can't tell me that there's just one case in Grand Forks or one case in Bismarck or one case in Minot. They're just not looking in the right places for those cases, because we know how contagious this is. We know they're out there. They're just not finding them. So we're happy with the results of that. Our hope is then, when you find those cases, then you educate and you do your contact tracing, and then they can appropriately isolate and quarantine. And then, that's just our way of kind of stopping that transmission piece. So we have an education and awareness component with the task force that we will be working to do some general education to businesses and in the community at large, as well as some of those higher risk groups. We will be doing some work with some cultural leaders in the community, also doing some quarantine and isolation support for people who maybe they aren't able to stay home for 14 days due to finances or due to living situations, those types of things. So we have some avenues within that our task force to provide some supports for them to make that a feasible process. We also started a web page for the task force now. You know, we are getting a lot of people who were asking. We didn't have a good avenue for people to ask questions for the task force, so I was getting people on my personal Facebook page that were trying to get me that way, and so it just, we needed a spot where we had a place for people to ask questions. So now we have the web page that is fargocastpublichealth.com/taskforce, and there is a question comment section in there where they can submit via email a question. And so since we've done that, we are getting a good amount of questions, which is great. So then the communications team works to answer those and to get those out to the individuals, and that hopefully will help to clear up some of the misconceptions out there. The other role that our harm reduction staff has done, you know, we have the homeless housing project that it has been in our area at a hotel location in town probably since April. So that has been for those individuals that don't have a home to go to, that would need to isolate or quarantine. And so our shelter staff, because they have a relationship with many of those folks in our mobile outreach team, Department of Human Services contracted with us to be site managers for that location. So that it was kind of a process to get going, but I think it's been super helpful that they have done that, and I think it would have not gone well had they not stepped up to do that. So that has, I think, been a fairly successful program from that standpoint. But those are kind of the main things that we're doing. The costs have been huge just in staff time. I think Saturday was the first day I've had a day off in 9 weeks, I think it was. Most of us are working, 60 to 80 hours a week. It's been exhausting, but we have a really good team. And I think we're getting to the point where our testing matrix is getting organized. We've had support from the North Dakota National Guard in developing our testing matrix, in doing our testing. We do have 3 static sites, which means they're kind of in a parking lot or things like that across the area where we're having some of our assigned groups come through. We also have a mobile team that can go out and do testing, like at the jail, things like that. So all of those things are kind of working together, and I think if a few more weeks in, we should have a pretty smooth process. And some of those testing groups are serial testing groups, so we might do them now, we might do them in 10 days, and we're just trying to kind of, our biggest worry is, of course, to keep it out of, the long-term care, and to keep it out of those environments where we really know that it could do damage if the virus is there. So those are our primary places that we want to protect. And sometimes that means doing the direct care staff that are kind of coming and going more, so that we can assure that we keep our those higher risk people safe. So that is kind of been our life in a nutshell, but I would be happy to entertain any questions anyone has, or comments, or wherever you'd like to go.
Thank you, Desi. I know there's been a lot of work around this, and so I'm sure folks commented at the beginning of the meeting, and I just want to say that I'm very proud of all the work that all the folks on the team have done, and will continue to do as we kind of navigate our way through this new world. But I know that there's some questions, and I have a few of them too, but Lynn had escaped me in the chat. So Lynn, do you want to ask your questions?
Sure. Thank you for that update, Desi, and I do want to thank you and your team for all that you're doing. I can appreciate all of the work that you've put into this. I work with the infection prevention team closely at Sanford, and they as well were having to be really creative in how we get people time off, because that is so important. So make sure that you are doing that for yourselves and your teams. I know you briefly mentioned the different cultural groups within the community, but I was just wondering if there were plans or resources from the state or the city to connect with those populations in our community that speak English as a second language, because even employers are finding that we're sending out a lot of information and it's in English, and just small things like some folks use the metric system, so when they see 6 feet, we need to help them, how do we translate that into numbers that they understand. But I was just wondering, and especially now that school's out, well, it's been out, but now as we go into official summer break, how do we work with our populations that might have that language barrier to understand how to safely navigate our community?
Yep. And Nicole Crutchfield, she's actually head of a subgroup on our task force, and they are specifically dealing with that topic. She has, and LSS is also on our task force. So they have met with many of the leaders within various cultures and really talked about like what are the basic questions that people have, what are the barriers that people are experiencing. And so we did like a question bank too of just like really basic questions that they kind of came up with, and then those went back to those cultural leaders then to bring to their groups. We're also working on some translated materials. So she really has been active with that group on not only the Fargo side, but on the Moorhead side as well. So I think it's not fully established in there. Again, I think we have some of that isolation and quarantine support that we probably could use for some of that group. I think there's also people that don't have masks or don't have, the hand sanitizer, things like that. So we're also looking at getting little kits like that could be dispersed like through LSS, or, so that we could access some of those to those higher risk populations as well.
Okay, perfect. Thank you very much. Appreciate all you guys are doing.
Thanks.
Other questions from the group? So, Desi, I just had a question on, we're seeing tons of telehealth. I'm sure Lynn's probably had her fair share of telehealth visits potentially as well. So any thoughts, given all of the federal relaxing of the rules related to how we utilize that service? Has that been something that you've explored in connecting with those folks at home?
I think so. We do the health briefing, with the health systems every week, and they have both mentioned, that telehealth has been a really good thing for them, and that there are people that really, really enjoy telehealth. And so I think, knowing that this is going to be with us for a while, right? Because people aren't immune to this. It's got a long way to go before we're going to hit any kind of herd immunity. We're going to have to kind of keep these creative ways of connecting in our pockets so that we can continue to use them. And I think, that too, the more we can help with that social distancing piece and use things when they're appropriate. I mean, there are times that we do need face-to-face things. And they did mention that too, that people are a little bit leery to come into the health systems. And some people who are really sick, not with COVID, but with other things, are waiting too long for things. And then they have bad outcomes. So we want the people who need to go in and see a provider to go in and see a provider. But there are times that I think that the telehealth is appropriate, or maybe, like with our WIC visits, sometimes to limit that in face-to-face contact, limit the time. You know, maybe you do a portion of it virtually and then you do a portion of it face-to-face, because then you can limit that, you know, face-to-face time where you're in the same room and have that droplet transmission potential, you know, all of that. So I think there's ways that we can just kind of make this a hybrid going forward and continue to use this technology, because it's been a learning curve for a lot of us. But I think now that we're doing it, some of it is kind of nice, it's kind of convenient, and I think it really does support the fact that when we, you know, going forward, we're going to have to do things a little bit differently for a while. And that, I think, it's good technology to have to continue to use it. I don't know, we do some telehealth here with our nurse practitioners in different counties. And we've been doing it with our Nurse Family Partnership Program as well, just early on. So I think they will do a little bit of both. I think they'll do some of the face-to-face, but yes, this is a good avenue to have. Plus, it's good. It would be a good option in the wintertime when you can't get out, and on those wintry days when, you know, we don't want staff out driving, and this is a really good option to have. And it still feels, you know, there's still that human part of it. You know, it's nice when you can see faces, and it's better than a phone call. So I think there definitely is a place for it going forward.
Okay. Just thinking through, just, you know, if there's any considerations to make sure that you all are able to do that, service client in that way. That's something that I thought I would bring up, because it certainly has shifted in that direction. I've heard many health systems say that it's forever changed. You know, telehealth is going to be much more prominent piece of how we interact with folks, and it's a chance, especially with folks coming in, if you can see kind of their living conditions, and it just changes quite a few things. So I'm glad that you're exploring that realm and using it to some extent, because I think that folks will kind of glom onto that as we move forward, and that will position us well for that. Okay.
We are using telehealth for the last year with Richland County and family planning. Our NPs do that whenever they need it. So that seems to work really well. So we've already had, you know, we already had the camera set up. We already had all of that in place prior to COVID starting, so that we were a little bit up on that.
Okay. Excellent. Perfect. I know John has some comments. Anybody else have any questions before I ask John to share his thoughts? Okay. John, you want to go ahead?
Thank you, Madam Chair. And we have not, as a board, met for a couple months, and I've had a lot of us have had a lot of communication with our team leadership, especially Desi, and at the city commission level and with the city level. Desi, I need to say this in this setting as well. I can't express enough how proud I am of you and your team. And our community can't thank you enough for the work you've done and for what you've delivered to the people and the sacrifices you've made to do this. And you've heard me say this before, but I just make yourselves also the highest priority you can. Keep your batteries charged, take care of each other, watch for your own people, because you're in this for the long haul. And just from the bottom of my heart, on behalf of the city and our other leadership, thank you so much.
I appreciate that. It's like I said, I couldn't ask for a better team to have around me. I think we've been together for a lot of hours, and I think we're really good at watching each other and knowing, you know, we all don't have good days, and we're good at figuring out like who's having a good day and who's not, and just how can we kind of help that, you know, help each other, because we know that we're kind of in this for the long haul, as you said. And so that part it's been really good for me to see how everybody is just willing to step up and do whatever they need. And so that has been I'm proud of them as well.
Any other questions or comments related to COVID? Okay. All right. Is there anything else that we need to touch on today, given the fact that we haven't met for a while?
Yeah, I don't think we have. This is kind of all. This is all we said. We don't remember what we did before this, so we're not quite sure. But I see our next meeting is scheduled for August, so we'll just have to, you know, see how we don't really know what to expect. You know, there's lots of different thoughts out there about what could happen over summer, but you know, nobody knows if it's just going to stay constant, if it's going to wane back a little bit, if it's going to, you know, go up in the fall. We have been told to prepare for a vaccine, you know, like at the end of this year, early 2021. But that's about all we know at this point. So that's going to be a whole nother thing. And then once, if they do find a viable vaccine, then of course it's going to be, you know, distributing and supply and demand and all of that, those really fun things to consider. So, but going forward, this will be a big year for us to really push flu shots. So as we start getting closer to fall, I think that's something that we as a group could push, because we can't afford to have a bad flu year and a bad COVID year together. And so I think we know we have a flu vaccine, and so that's going to need to be our push in the fall.
Definitely. John, you got another comment?
Thanks, everybody. I have a question from Mike Thorstad. Is this your last meeting?
Oh.
Well, it's the last meeting of this group, I think, but I'm still on the job. People keep trying to kick me off early, but they still got to put up with me through the end of June. So yeah, I've been on this group for 12 years, and it's actually they put me on here as the real fish of water, and I'm at least can swim a little bit now. But I think I reiterate what you said, John. You got some really good people, and it goes to show when you really depend on them, they've come through in the clutch here. So, you know, it's been fun. So yeah, you'll get to get a new player here in August, I guess.
Do we know who that is?
Pardon me?
Do we know who that is yet, Mike?
Well, the election's June 9th, so I guess you'll have to see who gets elected, and I would guess the newbies will get it, because everyone, Rose and Rick, everyone wants to hold on to a portfolio they're comfortable with, so anything that opens up always seems to go to the new people. So there's going to be at least one new member, so maybe two.
Well, we
Mike,
have your support.
Go ahead, John.
I'd just like to thank you, Mike. It's been a pleasure to work with you over these years, and you never know, I might not be back in a couple months either, but it's just been an honor and a pleasure, and thank you for your public service.
Well, thank you. And it's always that's probably the thing I've enjoyed the most of all this, is I've got to meet a lot of great people. And I was looking at Rick's background there, and that's what I'm envisioning here come July 1st. I think it says lake in the back, so I think he's sitting at the lake. So
you got that
hopefully
right.
that'll be me, but not on the conference.
Yep.
Excellent. Well, yes, thank you, Mike, for all your years sitting on this committee, and best wishes at the lake. That sounds fabulous.
All right. Thank you.
Yes. That we need to walk through. Okay. None. Adjourn.
So moved.
Can I get a second?
I can second.
All right, all those in favor?
Thanks, everyone.
Aye.
Thank you, everybody.
All right.
Bye, everybody.
Thank you.